they told me to have a seat, and they were trying to connect with my pulmonologist and if I had his cell phone number. So they
Hmm.
connected with my pulmonologist, and within 20 minutes or so, he called me and told me my CT was not good and that I had lung cancer.
Kelly, I am so sorry to hear this. How did you feel in that moment?
Scared. I think that was probably the word that came to mind. I was terrified because of how I felt at that time and then hearing lung cancer. I called my husband and connected a three-way call with me, him, and my pulmonologist.
Mm.
And
So
he
you were there alone.
I was there alone because I thought I was
Mm.
just getting a scan and then
Right.
I was gonna be sent home and it was gonna pop into my chart. So I never imagined that, you know, I would be getting a diagnosis right then and there.
Hi, I'm Dr. Raven Baxter, aka Dr. Raven the Science Maven, and I'm a molecular biologist and science educator. I'm also the host of Science Will Win Season 6. This season is all about cancer, how our understanding of it has changed, and how the science community is working together to understand and tackle the latest cancer challenges. Like always, we're bringing you a new episode of Science Will Win every week, wherever you get your podcasts. But we're also doing something new. For each episode, we'll be sharing a full length video interview between me and one of the guests on the show. You'll get to hear what couldn't make the cut for the podcast episode and really get to know some amazing people. And on the audio episode this week, we're diving into targeted therapies and biomarker testing and how they've transformed how we diagnose and treat cancer. But today, I'm talking with Kelly Huffman from O'Fallon, Missouri. Kelly has worked at Pfizer for 26 years, and before that, she was a nurse. And as you'll hear, Kelly is someone who loves staying active, from a career that keeps her traveling to waking up at 5:30 in the morning for boot camp. But in 2022, everything changed. The day before Christmas Eve, Kelly was diagnosed with stage 4 non small cell lung cancer. And that moment was terrifying. But it also marked the beginning of a very different kind of cancer story, one shaped by biomarker testing and targeted therapy. Kelly learned that her cancer was ALK-positive, which meant there was a treatment available that was designed specifically for what was driving her disease. So let's pause on that phrase, ALK-positive, because there's a lot of science packed into those two words. ALK stands for anaplastic lymphoma kinase. It's a gene that makes a protein act like an antenna on certain cells, especially in a person's development. When it turns on, it sends messages that say grow, survive, and develop. Once we're grown, ALK is supposed to quiet down, but in ALK positive lung cancer, the gene gets rearranged and fused to another gene, creating a signal that gets stuck in on, like a gas pedal jammed to the floor. So when doctors say someone is ALK positive, they mean we found this specific mutation driving this cancer and we know how to address it. That's where targeted therapies come in. Instead of affecting the whole body like traditional chemo, ALK targeted drugs are designed to shut down that one faulty signal. And that's why biomarker testing matters. Without it, all you see is stage 4 lung cancer. With it, you see a specific cancer and a specific plan. Now let's get into my conversation with Kelly. All right. Well, Kelly, there's been a lot of built up anticipation for us finally having a conversation. And it is so great to have this time to sit down and meet you and learn all about you. How are you doing?
Thank you. So very nice to meet you too, Raven. I am doing really well. Thanks so much for asking.
I'm glad to hear that. So, we're just meeting for the first time. And for the people who are also meeting you for the first time, can you tell us about you? Okay, your name, your age, where you're based, a little bit about your family and what you do at Pfizer.
Yeah, absolutely. So I'm Kelly Huffman. I live in O'Fallon, Missouri, which is a suburb of St. Louis. And I have been married to my husband for 25 years. His name is Sean, and together we have 2 kids. My daughter Brooke is 22 and my son Gage is 20. And I just celebrated a huge milestone. I turned 50 in October, and
Woo!
I know it was exciting. I
Congrats. That's
Thanks.
awesome.
Yes, I was very excited to hit that milestone. And I've been with Pfizer for 26 years. Prior to Pfizer, I started my professional career as a registered nurse. And then I decided to join the pharmaceutical industry and started with Pharmacia way back when. And currently, I am in vaccines. I'm a retail account manager for Pfizer. So I provide education on respiratory vaccinations to pharmacists, their leaders, and pretty much anyone who works in the pharmacy. So it's a busy time for us this time of year.
That is such an important role. So, as you know, today we are meeting to talk about oncology,
Mhm.
cancer, but you're so much more than that. And I want people to get a really great understanding of what do you do on a day to day basis? What does your life actually look like? And how we're going to do this is just rewind before cancer was on your radar. What was a day in the life, a week in the life of Kelly like?
Yeah. So before cancer, I started my day every morning at 5:30 and would go to a boot camp at 6:30.
Whoa.
Yeah, it was early in the morning and very intense workouts, and I did that for 5 years pre-diagnosis. And then, I started my workday. I came back and my workday would either be at home, doing virtual education or virtual meetings with my customers, or it would be out in the field and traveling. I cover 6 states. So that means, hopping on a plane or in my car and getting in front of my customers to plan and then getting out and doing a lot of education.
That is very impressive. So you're saying you would get up at
Yeah.
5:30
Yeah.
AM
Yes.
every day,
Uh-huh.
workout in a
Yeah.
boot camp, not just
Yeah.
a casual workout. This is like intense stuff, it sounds like. And then you would go to work, and then you've got a whole family to take care of. Like, that is really impressive. My goodness.
It was busy. It was busy. And I look back at getting up at 5:30 and I shake my head and wonder how on earth I did that back then for so long because, that's really early in the morning, especially in these cold winters in St. Louis. Getting up and getting out of bed it can be tough to do.
Absolutely. As someone who's from Buffalo, New York, I empathize with you. It gets difficult in those winters.
Yes,
And so sounds like you had a very active life.
I did.
And then your body started sending some signals. And can you walk us through your journey of having the life that you just explained and then the early symptoms? What was that like?
Yeah, I can vividly remember when my symptoms first started. It was in July of 2022. And it started with a cough. And you'll hear that from so many people who get diagnosed with lung cancer that that's how their symptoms began. And it was a cough that wouldn't go away. And, at first you just think it's something respiratory, maybe some allergies. And so for the first 3 weeks of this cough, I just treated it like that. And then finally I decided to go to urgent care as I was preparing to travel to the East Coast to drop my daughter off at
Mm.
college. And I went to urgent care and they did a workup, which included an x ray, which was read as clear. Spoiler, it was not clear. And I was diagnosed with GERD. And they just gave me a medication and sent me on my way and told me to follow up with my doctor in a few weeks if I wasn't better. So that's how it began, is with a cough and with an urgent care visit.
Okay. So as all of these symptoms are being called whatever GERD,
Mhm.
could have been allergies, it
Mhm.
could have been acid reflux, it could have been asthma. Did lung cancer ever cross your mind as I mean, do you smoke?
I don't. I'm a non-smoker.
You're a non-smoker.
Yeah, it never crossed my mind, and I can tell you it did not cross the mind of my primary care doctor either.
Ugh.
It was, the last thing on my list of differential diagnosis is, never even imagined that would have been on there.
How did you feel when they came away with the GERD diagnosis? Because, uh, I wasn't hearing that you'd had any GERD symptoms otherwise in your story, so
Right.
did you go on to pursue additional testing?
I did. So, well, at first, I just tried it out, to see if it was GERD that maybe was causing my cough. So, after several weeks of no improvement, I decided to see my primary care doctor. And at that time, she told me just to continue. It's probably either GERD or allergies, to continue what I was doing and then follow up with her if I wasn't better. So again, I felt a little dismissed. And at that time, I decided because now it had been probably a good 6 weeks and I still had this chronic cough. So I decided to see an ENT, and the
Mhm.
ENT diagnosed me with asthma. So he sent me back to my primary care doctor and said, have her prescribe, some albuterol and see if you have some improvement, with being on an inhaler. So that was my next step is trying to see if it was asthma and to see if my symptoms would resolve with some of the medications they had given me.
Let's talk about ultimately you coming to a lung cancer diagnosis.
Mhm.
How did it get to that point?
So after seeing my primary care doctor multiple times, I also went and had pulmonary function tests done and went back to my primary care doctor who diagnosed me with long COVID. After a month of being in this treatment, I decided to call an old friend who was a pulmonologist, and he's across the state in Kansas City. We had a virtual visit, and at this time, my symptoms, of course, had progressed. So it went from a cough to severe shortness of breath,
Mhm.
not being able to even walk up a couple flights of stairs. So he decided it was time for a CT scan, which I agreed. Um, I also had coughed up blood and was starting to have some back pain right during that week where I had
Ugh.
that virtual visit with him. So it happened to be the week of Christmas of 2022 when I went in to get the CT scan. And when you go get a CT scan, usually you get the scan, they send you on your way and say,
Mhm.
check my chart, and you'll get your results in a few days. That wasn't the case in this scenario. So they told me to have a seat and they were trying to connect with my pulmonologist and if I had his cell phone number. So they
Hmm.
connected with my pulmonologist, and within 20 minutes or so, he called me and told me my CT was not good and that I had lung cancer.
Kelly, I am so sorry to hear this. How did you feel in that moment?
Scared. I think that was probably the word that came to mind. I was terrified because of how I felt at that time and then hearing lung cancer. So it was very scary. This was on December 23rd, so just a few days before Christmas. So I called my husband and connected a three-way call with me, him, and my pulmonologist.
Mm.
And
So
he
you were there alone?
I was there alone because I thought I was
Mm.
just getting a scan and then
Right.
I was gonna be sent home and it was gonna pop into my chart. So I never imagined that, you know, I would be getting a diagnosis right then and there. So my husband came and picked me up. I don't think I could have driven at that moment. And
Mm.
then I called my family members that lived near me. Luckily, my 2 sisters, my mom and dad, and my 2 kids were at home, and they all came over, and I told them my diagnosis. At that time, I didn't know anything, even having a nursing background, I didn't know anything about lung cancer, um, specifically, about morbidity and mortality and all that. So I said, "We're gonna have a great Christmas. We're gonna put this aside, and we're gonna tackle this after the holidays." And that's what we did.
You are so strong. Oh my goodness. I'm I'm just really moved by your story. Was there anything that the doctors explained to you in that moment, or did they just simply share with you that they found a mass?
The only thing he specifically shared is that lung cancer has come a long way
Okay.
and that there are different mutations and targeted therapies if I had a mutation, and then other therapies. So he briefly explained that. And then we kind of started thinking about what's next after the holiday, because getting sick around the holidays is not ideal. I'm just going to say that because everything gets pushed aside because it's the holidays. So I didn't get admitted to the hospital until the 27th, and my symptoms were progressing pretty severely then.
Mm.
So I got admitted and had a chest tube placed in my left lung and spent a week in the hospital getting a whole workup, and, it was a New Year's I won't forget, let's say that. Let's just say that.
Oh my goodness. Okay. And so what is the path after that? Like as you shared, most people, or many people, I should say, when they come in for a scan, they are sent home. But when you're
Mhm.
kept in the hospital and there needs to be a plan made for your treatment for what they discovered, what did that look like for you?
So, honestly, I will say not a whole lot was shared with me.
Wow.
So, while I was in the hospital, I was getting multiple tests done and really with no explanation.
Mm,
So, they're telling me in the middle of the night that I'm going for a brain MRI. And of course, you're like, "I have lung cancer. Why are you looking at my brain?" Not knowing that lung cancer loves to go to the brain.
mhm.
Now I know that. So, as I was getting tests done during my bronchoscopy, PET scans. I knew a little bit about these, but nothing was really discussed with me as far as what tests were being done, maybe potentially the different types of cancer it may be, like different types of lung cancer. It was just not discussed, which in hindsight was really frustrating. I think that's a place they could really improve in the hospital is doing a little bit more explanation so your patients have a thorough understanding of what's going on.
Absolutely. And you would know better than many people because you do this as a pharmacist educator. So,
And I actually had worked as a nurse in the
yes.
hospital that I was at. So
What?
it was the same hospital that I worked at, um, in which I was admitted. Yeah.
What was that like? I mean, I'm sure that you probably never in your wildest dreams imagined that you'd be on the other side of the table.
I definitely didn't. Um, it was completely different than what I remembered because it had been, I don't know, roughly 22 years since 22, 23 years since I had been a nurse. And it was different. And they had me blocked as a VIP
Oh.
because I was there. So it made it difficult for people to come visit.
Oh.
I'm definitely not a VIP just because I worked there as a nurse, but it was different. It was different because noticing now a lot of nurses are travel nurses and what they do is a little bit different. I had subpar care there, and it was really disappointing, going as my employer years ago to a patient to see how I feel the care had gone downhill.
Mm. I'm really sorry to hear that.
Yeah, it's frustrating for sure.
And so there was little explanation. I'm sure, as you said, that was frustrating.
Mhm,
And so when you get the results of all of these tests, what do
mhm.
they reveal?
In the hospital, when they did the brain MRI and they did the PET scan, there was a resident doctor that had come in and started discussing my diagnosis. And then she stopped herself and she said, "Did they come in and talk about the results of your brain MRI and your PET scan?" And I said, "No," because at this time I had no idea that it had metastasized everywhere it did.
Mm,
So that stage 4 diagnosis was given to me in such a nonchalant way that she's like, "Oh,
mm.
yeah, you have stage 4 cancer. It has metastasized to your brain, to your liver, to your bones, to your adrenal gland, and to your pleural space." And I was blown away, in the manner that I was told and learning that it was stage 4, and I had many family members that were in the room, and it was a very, very awful moment of my time in the hospital learning that I had stage 4 lung cancer. So, that was how I got that diagnosis, and as far as finding out about my biomarker, the mutation that I had, that is another, little bit of a struggle because I had several different, testings done in the hospital that I learned after the fact. I had a Tempest test and I had a FISH test looking for biomarkers for lung
Mhm.
cancer, and they didn't tell me that that's what they were looking for, until after my discharge and I was seeing my oncologist. And what I'd found after a couple of visits, after a few weeks of being discharged, is that one of the testings had been mislabeled and it sat in the lab for over several weeks. So
Kelly, no way.
I was getting nowhere with this. And it was shocking to hear that. So here I am waiting to see if I have a biomarker. They're talking about starting chemotherapy, and so I'm losing faith in this hospital system that I used to work at, and that's when I decided to call a friend, another friend, and I traveled to get a second
Nice.
opinion.
Good.
Yeah. How that came together was such a blessing, and I saw him, and he called me, he goes, "Where are the testing results?" And he called my local oncologist right there on the phone, and she had to tell him they're not available because they were mislabeled.
Mm.
So, it wasn't until a few weeks after that, so we waited a good 3, 3.5 weeks to get the testing back and found out that I did indeed have a biomarker and I was ALK positive.
And did they explain to you what that meant?
So, my second opinion doctor, who is now my treating oncologist, he did explain. He did a very thorough job of explaining, even at my first visit before I got the results back. He did a really thorough job sharing what biomarkers are, talking about the different types of lung cancer. He had drawings. He upskilled me significantly on lung cancer. So, I was actually praying that I was either ALK positive or it was one of those biomarkers that there was significant advancement in treatment. So, learning about that, praying on that, and then knowing when I finally got that information shared with me that I was ALK positive, it was definitely a blessing during a very dark time.
Absolutely. And thank you for sharing that part with me. I have supported one of my best friends through a colon cancer diagnosis and subsequent treatment. And
Yeah.
um, we're both in our early 30s. And like we never thought that this could happen. And I'm just so glad that you found a supportive physician to take care of you, to help walk you through, share knowledge. I mean, Kelly, can you share a little bit about what it means to have someone thoroughly explain things to you? What does that actually do for a patient when that education is provided?
I definitely think the biggest thing is it gave me hope. Like,
Mhm.
knowing and hearing about a different clinical trial that he had done and, like, going into the science, it gave me hope, but I also think it empowered me to help make appropriate decisions on my care, and part of that is choosing where I was gonna be seen and deciding that he's no longer my second opinion oncologist, and he's my treating oncologist. So I travel to Houston to see him every 3 months to get my scans. So I get a PET scan, I get a brain MRI and blood work done every 3 months, and it has now become my norm to hop on a plane to Houston and travel and see him to get the care that I think I deserve.
Absolutely. I was just going to say the care you deserve.
Yeah.
Precisely.
Mhm.
And so let's talk a little bit more about your journey now that you um, understand and now it is known that you do have a biomarker, you're ALK positive.
Mhm.
When did you start therapy?
For sure, yeah. So I started therapy on January 27th of 2023. I had upon discharge from the hospital, I still had drainage. So the cancer was still obviously even after I got my chest tube removed, it was still doing its thing, right? It's replicating and this fluid keeps accumulating in my lungs. So
Mm.
they had to put in a Pleurix catheter, and I had to drain my lung at home, every other day. So, I was draining roughly 450 to 550 cc's every other day.
Kelly, I had to look up. I realized cc's are cubic centimeters,
Oh, okay,
which
yeah.
which means 550 cubic centimeters is 550 milliliters.
Mills, yes, yeah.
That is so much
Mhm,
fluid. So for those listening to envision that, take a
mhm,
2 liter, divide
mhm.
that essentially by 4. 1/4 of that is what Kelly was draining out of her lungs every, you said, couple of
Every other
days?
day.
Every other day. Like, that is so much. I'm so sorry. And
Yeah,
that had to be so uncomfortable. I'm sure you were coughing all of the time. You're
I was.
basically drowning, it sounds like. Oh
Yeah,
my
and
goodness.
this is really gonna blow your mind. So, going back to when I got my chest tube placed, they took out 4 liters of fluid.
No.
So picture my left lung completely filled with fluid to where my heart and trachea were over on my right side because I
What?
had a complete collapsed lung and it was pushing everything over to the right side of my chest because I had that much fluid in my lungs. So 2 liters, 2 2-liter bottles of soda is what was drained from my lung. It was crazy. Yeah. No wonder I couldn't walk up a set of stairs. It was awful.
And so you mentioned your treatment.
Mhm. There are multiple products out there for ALK-positive lung cancer. Don't get me wrong, I still know I have cancer every day. It's something that I think about every day. I'm also always looking over my shoulder and knowing that, progression could happen at any time. So you live life a little bit different when you live according to that.
That's totally understandable, Kelly. So we talked about your day-to-day
Mhm.
before your diagnosis. What about today? Are you still working? Are you still active? How has your perception shifted since all of this has occurred?
Yeah, so definitely life has changed a little bit for me, actually pretty significant. Basically, I don't do the burn camp, the boot camp
Okay.
anymore, so I don't get up early in the morning and do that. I do try to exercise as much as I can. Um, and that consists of walking. So I belong to a gym and I do walking now and maybe some light weights. So completely different than what I used to do in the past. And that's because I have a lot of fatigue. So
Mhm.
it definitely is draining. So I definitely rest when I need to, and I continue working full time. I travel. I travel a lot for work, and I just rest when I need to. So Pfizer's a great company to work for. My boss is super supportive, and I take the time that I need by still getting my job done. So I'm really lucky to have an employer that supports patients with cancer, and then I guess the last piece of this is I travel a little bit more. My husband and I, and even my kids, we have been to, I think, 5 to 6 different countries since my diagnosis, and it's been great. So, it was, our first trip after my diagnosis, we took the kids to Greece, and
What?
yeah, I was like, "We're doing this. We're doing this big trip," and we're
Nice.
yeah, so we did 10 days in Greece, and, so we're trying to do more things and enjoy life because um, life is uncertain. So, but yeah, I try to keep my spirits up. I am doing some advocacy work within Pfizer.
Can you tell us more about that? I know with my best friend and his colon cancer diagnosis, as soon as
Mhm.
he started treatment, he said, I want everyone to know about this and no one should have to go through this if
Yes,
it's avoidable. So, did you come out? It seems like you came out of this experience with that similar feeling of, I want to raise awareness. So,
I
tell us
do.
all about your advocacy and awareness work.
Yeah, so I decided to do some things to help spread awareness and raise critical research dollars. So I first joined. Pfizer has a community called the Butterfly Community, and I joined that group. And that group is about supporting other colleagues who face similar situations as myself. So
Mm.
that was one of the first things I did, as well as joining Immerman Angels. Immerman Angels is a company that has patients who have cancer connecting with patients who have cancer. So when someone new gets diagnosed with lung cancer and wants to speak to someone who's been in their shoes before, then they connect us and we start a relationship. So, we're able to talk about side effects and palliative care and just all different things that come with having cancer, working with cancer. So, I joined Immerman Angels. It's a huge community that, we support each other. We're a big family and we really help each other get through life. And then with Pfizer, I have been a part of a growth gig most recently with the advocacy and professional relations team. And I'm a run walk captain working with all of the big lung cancer advocacy groups like Longevity, Go to Lung Cancer, the Lung Cancer Research Foundation, and ALK-Positive. So I've been working with a couple colleagues on the advocacy team, and we've been planning the different walks, the summits, and just being able to connect with these people to do what we can to raise money. So that growth gig is wrapping up this month, and I will tell you I'm a little sad to see that ending because being a part of the advocacy and professional relations team has been so good for me. It's been a great year of raising awareness, sharing my story, and hoping raising funds too, because medical research is needed to help not just patients with ALK, but lung cancer patients everywhere because it's one cancer that is really underfunded, and we need to work on changing that.
So, I I know that a lot of people think of smoking when they hear lung cancer, and they that
Yeah.
may be attributed to a lot of the commercial messaging that we got on the anti-drugs campaigns of the 90s,
Mhm.
etc., where we would
Mhm.
see people experiencing harmful effects of smoking things like tobacco products. But we know, of course, that lung cancer can impact anyone.
Yeah.
Where do you think that that perception came from? Do you think there's a lack of awareness or a stigma around lung cancer? What are your overall feelings?
I totally agree that there is a big stigma with lung cancer. And a lot of the time, I tell somebody that I have lung cancer, the next question is, "Oh, do you smoke?" And I'm like, "No." And again, I it can be frustrating that that question's being asked, but at the same time, again, I think it's the stigma. I think it's what they've heard, from TV and from news sources that smoking causes lung cancer, which it does. Um, but I definitely think it's a stigma that we are really trying to overcome. And in fact, Longevity has a shirt as I attended their walk in New York this year, and it says, "Anyone with lungs can get lung cancer." And I think that's such a valid statement that we need to share because it's not the case that you have to smoke to get lung cancer. And I even think that, looking at my primary care doctor, that, she wasn't aware. So I think, one thing we need to do is make sure that our medical community is aware that anyone can get lung cancer and that younger people are getting diagnosed earlier, especially women under 50 are getting diagnosed with lung cancer as non-smokers, and that they need to be aware of this and the symptoms they present with so more testing could be available and earlier treatment can be started. And I go back to my trip to urgent care in of that July of 2022, and I mentioned I had that chest x-ray. I looked at that chest x-ray months later after my diagnosis, and there is clearly a tumor. So, and I say that because it's important to make sure that that imaging is seen by other people. Like, if my primary care would have seen that imaging, would she have seen the tumor? And could I have gotten diagnosed earlier and been able to start treatment earlier? I think that's important, to know that the earlier that we can get diagnosed and start treatment, the better. And so many of us share the same story that it gets progressed. It takes months or even years to get diagnosed, and that's something we really need to change.
Mm, I 110,000,000% agree with you. Kelly, we're coming up on time, but I want to make sure that you have the opportunity to share anything that I did not ask you about today. I want to make sure that we get as much as we can about your story, if you have time.
Yeah, absolutely. I mean, I think the biggest thing that I have learned from this is you have to be your own advocate. You have to continue to push for answers when you're not getting them.
Mm,
And I think that's something that is critical. So if you are experiencing symptoms or if anyone listening is having any health challenges, don't stop until you know that you have gotten the answers that you're wanting. And if that means doing things on your own and seeking other providers to work you up, travel across state lines to see a specialist. Whatever you need to do, you need to do it because you're worth it, and it's just critical that you need to advocate for yourself. I think that would be my biggest advice, and then the last is enjoy life because it can throw you a curveball at any point in time. Travel now and enjoy those times with your family, make memories, take the pictures, and just enjoy life. And that's what I'm trying to do. enjoying life with stage 4 lung cancer. It can be done because there's a lot of hope. So just know there's hope with cancer, and new treatments are being discovered every single day.
Oh, Kelly, I cannot wait to share this story with the world. Thank you so much for your time, your energy, and your story. You are amazing. Shout out to your care team, your family, the healthcare practitioners for helping you get to us today. And I am wishing you health for many, many years to come.
Thank you so much.
Of course, with that, I am saying goodbye to our audience, and we'll see you next time.